Welcome to Dr. Toya's channel. I usually do my podcast from United States, but this time I'm coming to you from beautiful city of Dubai, United Arab Emirates. So I have a very special guest with me, Dr. Raef Atef, plastic surgeon specialist, who is joining us today. So before I get started, I'd like to introduce him. Uh, Welcome, Dr. Raif.
Welcome. Thank you. Thanks for having me today.
Thank you. So, Dr. Raef Atef is a highly skilled plastic surgeon specialist originally from Egypt, and he completed his master's degree in general surgery in 2014 and got his medical degree in plastic surgery in 2023 from Beni Sui University in Egypt. His extensive experience training covers all major specialties of plastic surgery, including congenital anomalies, hand surgery, burn treatments, maxilla reconstruction, and both constructive and aesthetic procedures. In 2024, Dr. Atif located to Dubai, where he now practices in the aesthetic field in AI Kubaisi Clinic, a diverse multinational healthcare center known for its excellence in patient care. With a commitment to precision and patient satisfaction, Dr. Atif brings a blend of surgical expertise and artistic vision to every procedure. So, my first question goes to you, Dr. Atif. So Dubai is such a vibrant and multi diverse country. So when it comes to beauty and aesthetics, so cultural background plays important roles. So what's your experience? What are the key variation in beauty concepts and aesthetics goals among the different cultures? How do you approach? How do you tailor their wants?
Yes, actually, this is a very nice question because Dubai here have almost all the nationalities all over the world. So my concept and my role is to do what the patient like to have, what her body of dream she would like to have, and then I try to do it. So let's say for the European people use would like to have like a very sculpted, slim body. So they like the abdomen to be extremely thin and the abdominal muscles or the six packs to be very evident. So we try our best to make it very clear, like a very slim abdomen and a very slim figure. For unlike the Arabs would like always to have like a very curvy figure. So we have the narrowest waist and a very wide hip. So I usually take time to discuss with the patient what like she have to good, and I do my best to make for her whatever she would like to have.
That's great. So my sixth question is technology has become essential part of the modern plastic surgery, especially it comes to communication and planning. So that nowadays the 3D modeling and software applications getting popular in everywhere in the country, especially all these developed countries like Emirates, Dubai and Emirates, and then United States, and then they try to visualize like this is how you're going to look like. But what are your approach, and is that going to be the same as how the computer shows, or is it the different the result it brings up, like how it works?
Yes, actually, here the practice is so much technology based. So it's not only the softwares, even the machines. So for sometimes we used to do our practice depending on the manual practice. Let's say for liposuction, I used to do manual liposuction. Now it's much different. Same principles, but different techniques. We use machines for the ultrasound assisted tightening of the skin and the power assisted liposuctions for um, fat removal. So it helps a lot to decrease the post-operative pain and the recovery time, and also it have a very profound effect in decreasing time of surgery. Also, the softwares also have a very big role in predicting like what could be the post-operative result. It's very nice and very applicable, especially in some surgeries like rhinoplasty. So it can give us like an idea what is the problem of the nose we have now and how could it be solved and what is the predicted photo of the post-operative.
It looks like it's gonna make the communication between the patient and the doctor much more easier, so they both calibrate what they want, what's going to be the outcome, and so they work together.
Sure, yes, yes.
Nice. So, what about like also like what about the different races? Do they all have the same evaluation? They go through the same evaluation, or it's different based on the races and the culture?
No, no, it differs between different races because there is like a natural beauty for each race. Okay, let's say if we are speaking about the nose, so the African nose has much difference between it and the European nose. So we need to achieve the natural beauty, not an artificial beauty or not a fixed beauty for each person, which then you will find that this nose doesn't fit to the face. We need to address to a specific problem of each nose. Let's say this nose has an hump or overriding. Okay, we need to correct it. It has much flaring or wideness of the base of the nose. We need to reduce it to match the original face, not to match another person's face.
Yeah, since you touched upon the nose, let's jump into the rhinoplasty. Rhinoplasty is one of the most developing procedures these days. So, introduction of the ultrasound assisted physioelectric osteotomy, known as the rhinoplasty. So, can you tell us a little bit more about that? What's the technology are you using?
Yes, for rhinoplasty in basic words, we used to modify the frame of the nose, and then the skin will give the coverage of the frame. So the frame of the nose is made of bones and cartilage. We modify cartilage by methods of suturing, and we modify the bones by doing osteotomy, which is like fracturing or cutting to the bones. Previously, we used to use like a hammer and an osteotome to do manual fracturing for the nasal bones. It was a little bit difficult and it wasn't much controllable by the surgeon. Plus, it gives some post-operative edema and pain for like maybe 2 to 3 weeks. Now there is a new technology, a device called piezo, which is like ultrasound power for cutting precisely the bones. So it is like the same technology used for drilling the teeth. Okay, so it's very precise and very clean, and it doesn't disturb the surrounding tissues. So after the surgery, it's a little or minimal edema that happens after, and you can control it very well in millimeters to do the exact cut you would like to have.
Good. So, yeah, the what about the revision rhinoplasty? So I know that some people they want the different result after they have some certain procedures, and then they go to the revision. So how many revisions can one person have? What are the possibilities, the good outcome that people can have?
Actually, rhinoplasty is one of the most common surgeries that patient may need a revision. We believe that the first trial for rhinoplasty is the best chance for the patient to give the best result. But sometimes it happens that it may need revision. Revision may be in like a cosmetic or a functional cause. Okay, so for function cause, let's say obstructed nose or airway problems, we may need to do revision for such problems. Also for aesthetic, due to under correction or over correction of the original problem. So if we had an hump and it was not completely corrected, so it may need a revision, especially there is some memory, especially for the nasal cartilage. So this memory may cause that the original problem a little bit recur. So we may need for revision. We try our best to do it from the first time, but we had to tell each patient the exact case of his own to be able to predict what could happen for his surgery.
So since we touch upon that, so improving the tip of the nose, this is getting popular, right? So as high as possible. So some people use the ear cartilage and some people using the rib cartilage, but also autologous cartilages. So what do you think when it comes to all these, some tools?
I believe that you should use the nasal septal cartilage first, which is already here in the nasal septum. So you don't need to go to an outside area like the rib or the ear. But if this, we say, storage is depleted from a previous surgery, you had to proceed for the ear, but it gives us a little amount of cartilage that we could use, or if you need a much amount, you need to go to the rib cartilage graft.
So yeah, so then what about anatomical research, especially facial fat compartments in different models of aging from volume loss and laxicity and skin changes?
Yes, it's actually very good topic. How could we understand how aging happen? If we understand well how age to the face happens, so we can try to reverse it. So for aging, it's like two main process. One is volume loss, and the other is drooping or ptosis. By aging, our face start to lose fat gradually. From the fat compartments in the face, we have compartments in the cheek, in the temple area, in the mandibular line. So losing these fats makes the face looks older. Okay, so the first way to try to compensate this aging is by adding volume. So we may sometimes do like fillers or fat injection to take some fats from other areas from the body to be injected to correct the volume loss. But this is the first point of aging. The most important point is the drooping or ptosis. Our face is fixed in fixed places with what is called ligaments. So if these ligaments by age started to weaken, it causes sagging down of the facial tissue. So it needs lifting, and it's usually surgery like face lifting or neck lifting. And it also gives us a more stable and more fixed rejuvenation for the face. The last point, and which also is very important, is the texture of skin itself. Skin is the mirror of the aging. So sun exposure is very harmful to the face and the skin. Here in Dubai, we have the highest worldwide ultraviolet index. It's like two places all over the world that have the extreme ultraviolet index. So sun protection is mandatory for anybody living in Dubai. As long as you get out to the sun, even for 5 minutes, you need to apply a sunblock. It will help a lot for prevention of premature skin aging.
So since you touched upon the fillers, if you can comment on the different fillers of the adipose, they're using the adipose tissue or just the fillers or the thread lifting to fight with the aging process.
Yeah, like what I said before, regarding the patient problem, we take the decision. So if it's about ptosis, we use lifting. For threads is for lifting. For replacement of volume, we use fillers. but it's not permanent. So fillers last maybe 6 to 9 months. Or we use fat, which is fat grafting or fat injection. We may use the abdominal fat to be redistributed to the face, and it's more natural and more permanent. Especially fat has like stem cells, which are rejuvenating cells, so it helps to rejuvenate the restores the volume and improves the texture of the skin itself, which doesn't happen by fillers.
Yeah, because of the stem cell that's inside it regenerates the whole kind of like a healing process,
Yeah,
right?
yeah, it's very amazing effect, especially when you see a patient who did fat transfer to the face. After 1 to 2 years, you will realize that his skin has marked change. So it's not only about volume; it's about the skin, which is the first look you have. Your eyes touches is the skin. You feel it's a very much younger skin.
So do you store the fats? You know, some of the clinics they store the fat. Like let's say the patient, the customer is like 28 years old. They store the fat, and then when the patient reaches to the 40 years old, they can use the 28 years old fat regenerated. Are you
Yeah, actually,
practicing
I
that?
heard about that, but actually, we don't have such practice here in Dubai. We don't have fat storage, and actually, it's still under trials. There is no solid data about such topic, so we just hear about some trials like that, but we never find a database
Proven
for such
system.
practice. Yes.
Sure, I understand. So since we talked about the nose and skin, let's jump into the eyes. So eyes are the center of the face, and but it shows the uh, anti-aging process way earlier than the rest of the face. So droopiness, hollowness. How are you fighting with the eyes, and surgically and non-surgically?
Yes, eyes, I believe it's the focal point of the face. And it ages so much quickly in some people, even some people in 30s, and they'd like to have a younger eyes. We do what's called blepharoplasty, what is rejuvenation of the eyelids. We do it for two main reasons. Maybe a functional reason, if it's too much drooping down, obstructing the visual axis, so it impairs the vision, but it's always in the old ages, like 70s and more. And we do the rejuvenation process for the eyelids for giving a more youthful look. Okay, and it maybe due to excess skin or some fat bags. So depending upon the problem, we do the intervention. If some excess skin, we remove the skin. If some fats, we remove the fats. And also we have like a minimally invasive process to use some machines like the plasmash or CO2 laser to tighten the skin without need for any type of excision. It fits well for the some cases, which especially with minimal laxity.
Yeah, what about like arms and legs laxity, like especially the back? Nowadays, people are worried about the laxity of the skin in the back.
Yes, actually, the skin has the capacity for recoiling down. Okay, so if you could remove the underlying fat that is causing the skin laxity, the skin to some extent can recoil back. So our practice for liposuction helps a lot for such problems, especially in some areas which people find it's like a stubborn fat, not responding for exercise, not responding for diet control. This practice is very easy. We just remove the fat from the problematic area, like lower abdomen, like the bra rolls in the back. Just within half an hour, you feel that you can ready to go home and practice your daily life. So it's very easy. Some more complicated cases, needs more difficult and more complicated procedures also, like lifting. So lifting, you don't need to just remove the fat. No, you need to remove the skin, which you are not expecting it will recoil to that much. So we may need to do like a tummy tuck or an abdominoplasty or a thigh lift or arm lift for huge redundancies, which is not expected to recoil to the enough amount by liposuction only.
So, what about, do you impressed by the result that you did?
Yes, actually, what makes me very happy when I see a smile on the patient face. Okay, so we do surgeries all the time, but my reward is to feel the patient is happy, and I feel my appreciation when she's telling me, "Look how it looks now." So this is what actually makes me happy. I appreciate and like always the nice surgical results, but the patient happiness and satisfaction has the highest priority for me.
Yeah, but like I'm an internal medicine physician, but I have this patients, but the different population. But I'm sure your population, patient population, is more like high standard because they're not coming here to the hospital for sick. They're coming to the hospital to become more younger, looking vibrant, all healthy people. So, is it
Yes,
difficult to work with these kind of patients?
actually, our books sometimes they called our patients our clients because they are not actual patients. They are
Exactly.
seeking some improvement for non-medical condition. So you need to have a long talk with the patient and take your time to discuss more frankly what the patient expectations, and you need to be realistic to the patient what you could offer for her and what is the expected improvement for her condition. If it is was discussed honestly, it will give the best result, I believe.
So, aging is a lifelong process. So, what about the follow ups and maintenance that patients should know?
I always encourage patient about prevention of aging is much easy than treating age. So the healthy lifestyle and healthy diet and maintaining stable and average body weight is the best way to fight aging. If you manage to keep good body weight and keep a healthy diet style, I believe you will have much late aging comparable to a person who is negligent in this topic. So prevention is the first part. The second part is to treat or manage, and this is what is our role to try to help the patient for his problem.
Yeah. So, yeah, I agree with you. But then, if somebody gets a one filler, they should stick to the one doctor and get this, like evaluation because that one patient shouldn't be going to the multiple different offices. So, and then it's not going to be properly cared.
Actually, the patient goes to different offices here in Dubai. It's like we have 5,000 plastic clinics, which is a huge number comparable to the population. But we always encourage the patient, if you find yourself is happy and feel it's okay with one doctor, keep with him because he's the one originally started with you and he's able to understand the full history of your beauty. So try to stick to some doctor. If you find some problem with the doctor, please refer to the same doctor first. Okay, he may be able to correct your problem. If you find that you are not satisfied, you can ask the doctor also to help you for referral for somebody else. He will be able to choose the best for you.
Okay, good. So, my last question to you goes yeah, so today's fast paced lifestyle, many patients are looking for aesthetic procedures that don't have a downtime. what are the procedures and aesthetic treatments would do you do, and what would you offer?
Yeah, it's a very nice. I usually try to tailor the surgery according to the patient need. Okay, so we sometimes do what is called a mini surgery. So we have a mini facelift or a mini tummy tuck, which is a small and a reduced incision and a reduced and smaller recovery time. For also the post-operative pain, which is the main cause for difficulty for coming back to the work. That the patient already did the surgery, the patient already left the hospital, but he's not able or she's not able to come back to the work again. So here is the role of pain control. We try our best to do the best pain control post-operatively. So as long as the patient doesn't feel in pain, he would be easily able to rejoin his work again. So we use many techniques like nerve blocks, like we have a devices called patient controlled analgesia. These devices makes the patient feel that he didn't do any type of surgery and he feels that he can move easily all around. So this is the point that you feel it's okay. Now you can join work easily. So if you focused on pain control, patient easily can come back to work easily.
Great. All right. Thank you so much, Dr. Raif, and for sharing such valuable insights with me and to my audience. So, hope you all learned something interesting and new. And to all our listeners, hope you enjoyed this episode. And please stay tuned, stay curious for my next episode. Thank you so much. Thank you, Dr. Raif. And
Thank you, Dr.
last words
Toya.
to you.
Thank you for having me today. It was a much pleasure for me. Thank you.
It was an insightful conversation for me as well. And to
Thank you.
my audience, I hope. Yeah.
Bye.
Thank you. Bye bye.